Good Monday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness at Knox County Health Department. Our moment of gratitude today is actually a moment of reflection. There's been a lot going on. There is a lot going on in our community right now across multiple levels, and it's been a very hard, intense few months. We want to encourage everyone to continue to show kindness, empathy, and grace for your neighbors. We are all in this together, and it will take all of us to make our community a healthy and safe one. Now I'd like to take a moment to talk about the cloth face coverings we received from the state and have been distributing here at the health department. On Friday, we saw a news story reporting a potential health risk associated with the state's cloth face coverings. In light of that news story, we reached out to the state to get more information and stop distributing the mask. We are no longer distributing the face coverings until more information is learned about the role, about the antimicrobial that is used on the mask, and have asked our partners to do the same. In regards to questions, if individuals should continue to wear the mask, the state's unified command has said that it is up to the individual whether or not they wear it. We are told that questions regarding the face coverings will need to be posed to the Tennessee Emergency Management Agency, or TEMA, as they are the entity who purchased and distributed the mask. As a reminder though, cloth face coverings can be made from t-shirts, bandanas, or basic cloth fabric. It doesn't have to be anything fancy, and we do have instructions on our website on how you can make cloth face coverings at home. Moving into our local situation, we have 410 confirmed cases of COVID-19 in Knox County. Additionally, we have 11 probable cases. 335 of our cases have recovered. 43 individuals have been hospitalized at some point in their illness, and no Knox County residents are currently hospitalized. We're also thankful that we have no additional deaths due to complications from COVID-19. We continue to see an increase in new cases over the weekend, most of which have been related to clusters, but not all of them. Identifying clusters is something that we expect to do. I talked about this a lot on Friday. This is especially as our community continues to reopen. The practice of finding these clusters and conducting case investigations is a part of what we do in public health. We are continuing to respond efficiently with case investigations, monitoring, and contact tracing, and that will result in an increase in cases a lot of times. But we also want to still remind everybody that it is important to follow the 5 core actions: practicing physical distancing, wearing a cloth face covering, washing your hands, sanitizing surfaces, and staying home when you're sick. These actions are not a replacement for one another. They are all critical and are effective when they're practiced together. We want all of our community we know that everybody wants to return to life as we knew it. We do too. But right now, COVID-19 is still very much a part of this community. And to keep moving forward in a safe way, we all must follow the 5 core actions. And now I'll open it up for questions.
Any questions, please go ahead and post them in the chat feature, and please remember to put your name and the media outlet that you are with. From David with WBLT, today is 1 month to the day of the start of the phased reopening, May 1st, and active cases up over 100% in the last 7 days. What warnings does KCHD have for the public with the spike in cases?
So again, that's what we just talked about. We really, really want to encourage everybody to continue to follow the 5 core actions to help prevent the spread of this virus throughout our community. And that's why we keep harping on that. We need people to take it seriously and to please work with us to do those things to protect yourselves and your loved ones, your friends, your neighbors. And that's really where we are right now. But we did expect to see increases as we reopened and had more people out and about and interacting more.
His follow-up question is the community still heading in the right direction?
You know, that's hard to see or tell right now. We'll continue to look and see. Like I said, again, we expected to see more cases. That's just natural when people are getting out and about more. But we really want to encourage people. It's concerning when we hear about people not wearing masks and going out when they're sick or going to work when they're sick and all of those things. We need you to continue to follow the guidelines so we can continue to move in the right direction.
From Shannon with WBIR, what kinds of specific things is KCHD doing to reach out and give guidance to the Hispanic community about vulnerability to COVID-19?
Yeah, so like we talked about last week, we had a group get together, kind of a focus group to give us guidance on how to get our message out and how to formulate those messages in a better way for the Latino community, our communities in our area. And so we worked with leaders from the community to get that guidance, and are working on putting video messages, short video messages out from feds, from CDC, and some local ones we're making, and asking them to help distribute those. We're also talking with churches in the areas to help get messaging out as well. So doing everything we can to try to make sure that the same messages, those 5 core actions and the importance of adhering to those can get to our Latino community as well. We want to make sure we're doing that in every way we can.
Another question from Shannon with WBIR in the same vein. They ask, in what ways are you working with the community, many of whom who have limited English language skills?
Yeah, I think I addressed that. So if you need more clarification, you can, but we're doing videos in Spanish and making sure that our messaging, and we have interpreters available when we're interviewing cases and doing contact tracing, all of those, we're using interpreters for those so we can speak directly to the individuals in their language. And so taking a lot of different actions across the board to try to help with the situation.
From WATE, they ask, is there any trend or connection between the non-cluster cases?
No, there really hasn't been. Again, nothing in the community to point out other than just really encouraging people to do all the things we're asking to keep from spreading the virus.
From Shannon with WBIR, are they okay? I think that's, are you okay with the recent spikes, and do you feel we are moving in the right direction for phase 3?
I think I've already addressed a lot of that, and we'll talk about phase 3 as we get later at the end of the week, as we plan to do. But it's concerning to know that we're having more cases, but again, it's also expected. We just really need the cooperation. I think that there's maybe some thoughts that this isn't as serious, or we shouldn't be worried about it. And we do want to continue to stress that it is very much still here. There's very much still consequences, that people can get really sick from this. And we want to make sure that we're protecting our loved ones and our friends and family. So we encourage people to continue to follow the guidance.
A follow-up question from Shannon was, any idea when phase 3 might be?
Not at this time.
Also from Shannon with WBIR, are you worried about a possible spike from protests or riots?
Well, then we'd be concerned about any large groups of people getting together in this situation, especially if they're not wearing face masks and socially distancing. And so it can be a concern right now, what happened over the weekend. The pictures I saw, a lot of folks had on face masks. The social distancing maybe wasn't as much. And so we encourage people to keep that in mind whenever they're in groups of people. And if you're concerned, you can always get tested. You can come here Mondays, Wednesdays, and Fridays from 9 until, I believe, 3 p.m. Thank you. Somebody held up a finger for me. 9 to 3 p.m. If you are concerned and you think that you could have potentially been in that environment without socially distancing or wearing your mask, and you might have been exposed.
From Vincent with the Sentinel, how many red lights would need to occur in order for a mid-phase adjustment to be put in action?
So as we said, there's not a one single data point we look at. We look at the whole picture. So like I talked about last week a little bit, there's the cases and our ability in public health to trace the cases and do the investigations and do the monitoring and all of those things, plus also looking at hospital capacity and what their ability is to take care of patients if they're needed. All of that goes into making the decisions on whether or not to move forward throughout the plan. And we will look at that as a group. It's not one piece, and there's not a single number of red lights or anything of that nature.
From Shannon with WBIR, there's been a lot of focus on tourism coming to us in East Tennessee, but as we enter June and July, we might have more people leaving East Tennessee on vacation and then returning. Does KCHD have any specific concerns with how travel could affect local COVID cases in the next 2 months?
Yeah, as with everything, we're asking people to use caution and think about where they're going and what their activities are and how they're getting there. And again, whether you're here or you're somewhere else, and I know I sound like I'm repeating myself constantly, but following those 5 core actions, no matter where you are, COVID is across this country and other countries as well. Stay away from people, keep that 6 feet of distance, wear a mask, wash your hands frequently, disinfect surfaces, and stay home. Don't go if you're sick. That's really important as well.
And I think that answered that second part of your question, Shannon, but if it didn't, feel free to type another question in. From Vincent with the Sentinel, are you concerned with the dampening effect this issue with the Silvador treated cloth masks might have on widespread mask adoption?
I hope that people continue to wear masks. And again, there's ways to make masks available on our website, and people can do that with t-shirts and bandanas and things they have at home. So I hope not. We really want to, and we still stress the need for wearing cloth face masks when you're in public. And it's very important to do so to help protect your community.
From Shannon with WBIR, how many masks from the state have been given out before the stop today?
So we've given the number before, I believe last week. We'll get the number. I can't remember what it was, but we'll get it to you and follow up on that. Sorry, I don't want to give you the wrong number.
And just as a clarification, Shannon, we didn't stop today. We actually stopped
Friday.
on Friday. Also from Shannon with WBIR, 16 Hispanic cases on Saturday. Is that a cluster, or were those cases spread out?
The vast majority were related to one of the clusters we had talked about that we were already working with, yes.
The follow-up question from her is, why are we seeing a spike in this community?
I can't say for certain, but I do think that making sure that we're working on our messaging and how we communicate with the Latino community is very important, and that we are working with trusted leaders within the community to also help us get messaging out as well is very important. And we hope that doing that will help with what we're seeing.
From Megan with WBLT, is the health department considering moving Knoxville backwards to phase 1 protocols due to increased cases?
Yeah, I can't talk about what the phasing will look like. Again, we'll talk about that later on in the week. But we'll keep you updated. But we are looking at the data and the information we're getting regularly.
Any other questions? Please go ahead and submit them into the chat feature now. All right, there's no more questions being submitted, so thank you all for joining us, and we will see you on Wednesday at 12:30. Thank you.